Welcome to the Natera Academy Short Takes series on genetic carrier screening. Natera Academy Short Takes are brief educational sessions to review helpful facts and information for the benefit of our healthcare providers. My name is Erin Armenti. I am a certified genetic counselor and part of Natera's medical science liaison team. In this short take, we will review how to offer carrier screening to patients. We'll begin by reviewing some decisions you will need to make regarding carrier screening paradigms, then shift our focus to how to discuss carrier screening with patients before testing and after results are received. First and foremost, you'll need to think about the type of carrier screening you would like to offer your patients. As we discussed in the first module, carrier screening panels can be broken down into three main categories. Ethnicity-based, where the patient is tested for conditions common in individuals of their ethnic background. Pan-ethnic screening, where the patient is tested for all recommended conditions regardless of their ethnic background. Or expanded carrier screening, where the patient is tested for a large panel of conditions. According to ACOG, all three approaches are acceptable paradigms for carrier screening, so think about what type of screening may work well for your patient population. Regardless of whether you are using an ethnic, pan-ethnic, or expanded carrier screening approach in your practice, it is important to keep in mind that for recessive conditions, it takes two carriers to have a pregnancy at risk for the condition in question. There are typically two ways to approach carrier screening in a couple. A stepwise method where one member of the couple, usually mom, is tested first, and then dad is tested only if mom screens positive. Some providers prefer this approach because it may be less expensive for the patient, or dad may not be in the office at the time of the patient's appointment to get his blood drawn. The second approach is to test both partners concurrently. With this approach, they typically receive the results at the same time. It is important to keep the timing surrounding these approaches in mind relative to the different options for intervention we discussed in the first module. Once you decide how your practice will be approaching carrier screening, your next step is discussing carrier screening with your patients. A good way of introducing the concept and utility of carrier screening is to inform patients that everyone is expected to be a carrier of at least one condition and that most carriers are in good health. On a large screening panel, we see approximately 60% of individuals carry at least one genetic condition. You will, of course, need to tailor your discussion for your patient's needs, but you will want to include a brief, high-level overview of recessive and X-linked inheritance so the patient is clear on when a pregnancy is at risk to be affected with the diseases screened. We then want to highlight that carrier screening is important for patients of all ethnic backgrounds to obtain information about their chance to have a child with a genetic condition. Many patients have heard of the frequency of certain diseases in certain ethnicities, but it is important for them to understand that carrier screening gives important information for individuals of any and all ethnicities. Lastly, we want patients to have a general understanding of the types of diseases included on a carrier screening panel, specifically that we are testing for many diseases with significant impact on health for which treatments and early interventions may be available. After reviewing this basic information with a patient, ask, is information about the chance to have a child with a genetic condition useful for you and your family? You may also wish to discuss briefly how the information patients obtain during carrier screening can empower them to make informed decisions during their pregnancy. We reviewed potential interventions following carrier screening in more detail during our first module, but it may be good to touch on the options available to a patient in the event that both parents are carriers to set expectations for post-test discussion. You will also need to obtain some information from your patients during your carrier screening discussion. You may wish to include in this discussion any questions about additional family history of genetic disease. If a patient does report a condition in their family, you will want to be sure that the carrier test you have selected does in fact cover this condition. You may also wish to refer such patients for pretest genetic counseling to review her risk to be a carrier based on family history and the extent to which carrier screening can modify her risk. Last but not least, you will need a post-test plan for your patients after their results are received. Your carrier screening laboratory can be a really helpful resource for you in these situations. Many labs offer post-test genetic information sessions for patients. You may also wish to refer the patient to a local genetic counselor who can also help facilitate diagnostic testing if desired. So what happens when your patient tests positive for a recessive condition? First and foremost, you want to normalize the results. You will want to remind your patient that everyone is expected to be a carrier of at least one condition. You then want to discuss carrier testing for the patient's partner. If the partner tests negative or tests positive for a different condition for which the patient is not a carrier, the couple is at low risk and there are no additional recommended steps for the couple. If the partner is unavailable, this may be a good time to refer the patient to genetic counseling to discuss prenatal testing options. It is also a good idea to remind patients at this point that first-degree relatives have a 50% chance to have the same mutation, so the patient may wish to discuss the results with family members. But what happens if the patient and partner both screen positive for a mutation in the same gene, or the patient tests positive as a carrier of an X-linked condition? We do want to keep in mind that positive carrier screen results does not immediately mean an affected pregnancy. For a recessive condition, there is a 1 in 4 or 25% chance the pregnancy is affected. For X-linked conditions, there is a 1 in 2 chance for a male to be affected and a 1 in 2 chance for a female to be a carrier. These are the situations where you will want to refer the patient for genetic counseling. We've spent a lot of time discussing different options for prenatal testing and postnatal follow-up, but the genetic counselor can help the patient understand the specific options for diagnosis and management of the disease in question, as well as go into greater detail about the condition. It's also important to keep in mind that some female carriers of X-linked diseases may require additional screening themselves. In summary, the ultimate goal of carrier screening is to provide patients with meaningful, actionable information they can use before, during, and after pregnancy. It may seem like there are a lot of points to consider in integrating carrier screening into your practice and counseling your patients, but please keep in mind that your carrier screening laboratory should be able to offer you guidance and support throughout the process.